Hi guys. Well, this is going to be my 4 months post-op update of my top surgery. I had periareolar surgery, which if you've watched the rest of my videos you're probably sick of hearing. But yeah, I didn't get a chance to do a 3-month one. Things have been a bit mental. To be honest, not much has changed anyway. The swelling seemed to go down pretty quickly after my surgery, so whereas usually it takes most people 4 to 6 months for the swelling to go down. Well, unless it just hasn't gone down, I don't know. I think it has, but not much has changed since my 2-month. I don't think. It might have, I don't know. But I just want to touch upon a few things before to do my testosterone. I've been on testosterone now for like 2 years and 5 months. And I've been getting these really bad pains in my stomach, almost like period pains. I'm getting them in my stomach and in my back, and they come on really intensely to the point where I can't move, and then they disappear completely for about 30-40 seconds, and then they come on again, and it's about 5 minutes of pain every time, and then I get about a minute off, and then it kicks in again, and this can last up to hours sometimes. There's once it went on for about 8 hours before I caved in and took some painkillers. But I discussed this issue with Dr. Penny Langahan in Charing Cross, and she asked me to get some bloods done. So I had them done to see if my testosterone levels were okay and everything like that, because she reckons it was attacking my ovaries, so I would need an operation to get them out. But I got the results back yesterday. I got the results of the blood, sent them to London, and got their opinion on it yesterday. So this is what I got. World's shortest letter. See? Tiny. So yeah, I basically got a list of everything they tested and the numbers, which means nothing to me. Then it says, this gentleman's hormonal therapy is optimised. His testosterone level is perfect, and the liver function and cholesterol are normal. There is nothing here to explain why the gentleman is getting abdominal pains, and I do not think it is related to his hormone therapy. Therefore, another cause for this should be sought. I would appreciate it if you could refer him locally for investigation. So basically, it turns out it's not my hormone therapy attacking me, I just generally have something wrong. Why it feels like period pain though, and have nothing to do with my testosterone, is a bit confusing, but we'll see. So I've got to get that sorted, so hopefully by the time I'm doing my 5-month update we'll know some more. So yeah, you obviously want to see what my chest looks like. So here it goes. So here's my chest. Obviously the scars have been stretched here, as I've said before. Looking at it now, they don't look too uneven, but I think I've come to the decision now. I'm going to ask for a revision, a nipple revision, when I go back next year. Yeah, I'm going to ask for them to go smaller because I don't like the size of them. But yeah, this here where you think I'm developing pecs, I'm not. It just is the shape of my ribs. So that's a bit weird, to say the least. But yeah, so muscle wise, I think I've developed abs out of nowhere. I can't say I've been working on them that much. And my V's as well. I don't even know where they've come from. Arms and stuff. I don't know. Not too much. And my back, which obviously I can't see, so you're just gonna have to tell me how that looks. So yeah, basically things are going pretty well. I can't say I'm 100% happy with it, but you know, what can you do? I'd rather this than have boobs, so I'm not going to whinge all that much about it. There's not really much to touch up on. I've obviously got this when I crease, I've got these lines here, like when I tense. But I don't know if they'll ever go away. Apparently they'll iron out. See, it's a bit... I probably should have done all this like looking at myself before I made the video, because you're just watching me stare at myself. But yeah, either way, you know, there's a lot of people that have told me I look really good and stuff like that, which, you know, I've seen worse. I've seen a lot worse. So yeah, what else? I don't know what else there is to touch upon, really. I did, well, I was told the last time I seen the surgeon that I was to do these exercises like stroke my nipples and stuff like that. I can't admit that I maintained that, so that might have something to do with what's going on. I did moisturise every day though. I don't anymore. I stopped around about the end of March, so just over a month ago now. There's a lot of things that I did that I shouldn't have done. And it wasn't, I'm not going to say I did it because I wanted to test the boundaries to see just how far you can push things, because obviously that's meddling with something I've waited for so long, but some of them I did because I couldn't do otherwise, and other things I did more out of a curiosity because trans people, like FTMs, were saying differently to what the doctors are saying, and I know that doctors, you know, they're not doctors for no reason, but then other FTMs that have already been through this would have obviously learned something. So yeah, the things like I didn't carry on massaging my nipples. Quite a lot of FTMs said that hasn't done any good for them, so I don't see the point in wasting 20 minutes a day stroking myself, and things like that. What I do want to talk about though is dysphoria. I did think before my surgery that this might make me feel a little bit worse about myself, strangely enough. Obviously I feel really good about the fact I've had chest surgery and the fact I can wear t-shirts now without a binder, and that the hot weather doesn't get to me so much anymore. That's great. But I knew that I'd feel a little bit off about still having female parts but flat chested. So yeah, I'd say that now, as I expected, I'm more dysphoric than I was before about myself, because at least before, although I was a man trapped in a woman's body, at least it was a woman's body. Right now I'm in the middle of two, and it's not something I find very attractive to look at. It's like, whether it be me or anybody else, I don't find the whole manly top half with a feminine bottom half a very pretty sight, personally. That's just my opinion. It's making me feel a little bit worse about the situation. But on a brighter note, I went to London 4 weeks ago, and the doctor there basically said the next person I'll be seeing now is the surgeon for my lower surgery. So that's good. So she reckons I'll be seeing someone before the end of the year, and possibly might even have my surgery started before the end of the year. So that's really good. That's really, really good. She offered me 2 types of surgery. I'm not sure if anybody else has been offered this. She offered me a phalloplasty, which is where they reconstruct the penis, which is obviously what I thought was the only option, or the maloplasty, I think. And my brief understanding of this is basically where they stretch your clitoris to make it longer, I think. You're probably laughing at this now if you know differently, but from, like, Dr. Penny wasn't really making much sense where that was concerned, and that is the kind of gist I got of it. Either way, she said that the maloplasty was becoming increasingly popular. I don't actually understand why anyone would want that. Again, that's my personal opinion, but she basically said, no, you can't use it to pee, you can't use it for sex, you can't, it obviously wouldn't be enough to be any form of packer, so I don't know. Personally, I'd rather a fully functioning penis, as fully functioning as it could get when it's been man-made, but yeah, I'd rather go for that option. So either comment below or message me or something if you've already had either one of these surgeries. I would love to know a little bit more about it. I've got millions of people asking me just because they think I know everything because I'm on the waiting list, but I really don't. I know probably about as much, well, maybe a little bit more than the average Joe, but yeah, so give me a message and let me know, basically. So yeah, oh, one more thing. I'm also going to be taking part in a documentary soon enough. I'm not going to name the documentary, but my mind's just gone blank. Yeah, but I'm going to be taking part in this, and I hopefully get to share my story as much as possible and get the word out there that I help other people and stuff like that, because I really want my message to go further across the world, if I'm honest. Not for me. Please don't think that I do all this so I become popular. I don't really care much about me. I care about everybody else that's in a worse off position than I am. I was there once upon a time when nobody would help me and nobody would refer me to anything, and doctors wouldn't even speak to me about it. So I want to be that person that they can speak to, the person I never had. So I'd love to get my message out there. So if you can, you know, share my videos and stuff. If you know anyone that's FTM, put them in touch with me. I'd be more than happy to help. So yeah, thanks for watching again. Check out my last video. I made a timeline on my surgery progress, so it goes right from the day before surgery to I think it goes right up to 6 weeks post-op. So I've taken loads of photos of, like, not during the surgery but being in the hospital. I got some footage of my plasters being removed and stuff like that, so if you want, check that out. And yeah, I'll see you next time on 5 months post-op. Bye.